Watch this.
Well, welcome everyone. Thank you for coming today.
The stage was set, the Lincoln Auditorium in Idaho State House. A press conference called by the Lieutenant Governor.
This idea of discriminating against and firing employees based on private and personal health decisions flies in the face of the principles of liberty and justice.
But as the opening scene played out, the presser...
No individual should be forced to do something against their conscience on a medical procedure.
...exposed itself as more of a pep rally. Proper political theater.
Does it go both ways for you?
They're not asking, they're telling.
Complete with perceived heroes...
Well, Brian, I just think those are two completely separate issues.
...and villains.
Do you think that the men and women who run the healthcare systems in our state perhaps know more about it than you do?
All merely players. Well played.
It's been a great conversation, and I don't know why we don't have more of this, so thank you. Thanks.
Very liberal use of the word press conference this morning, a description I'm sure the group would appreciate. The point of today was for the Lieutenant Governor and guests to discuss the recent announcement that some private medical providers are going to require their employees to get the COVID-19 vaccine or get another job. That was the announcement made a week ago today by 3 of Idaho's major healthcare systems, St. Luke's, St. Alphonsus, and Primary Health. Those companies say they're doing this to protect the patients and staff inside their facilities. A requirement, we're told, was inevitable, but it still struck a sour note for some. And after the remarks this morning from McGeachin and some of her guests, Joe Paris spoke with the Lieutenant Governor about her stance on vaccines and the decision made by area medical groups, like what Lieutenant Governor McGeachin would like to see in terms of action to address the issues she sees with private employers requiring a vaccine for employees to keep their job.
I'm not going to even go there because that's not my role, as I'm not a member of the legislature anymore. But I, as a member of the executive branch of government, I can play a role, and that's why we drafted up that letter. And I did ask the governor yesterday if there's something that we could do together, you know, to try to resolve this so that we can listen to the concerns of the employers, especially those in the healthcare industry, but also respect the rights of the individual.
I know critics of yours have said that this is an example of you trying to reach into private business and say the government's going to reach in and regulate and stuff. Is that fair? Do you think this is something that you're trying to reach into private business and tell them how to do their job, or is that a mischaracterization?
That's a mischaracterization because I'm a business owner myself. I'm an employer, and I do not like the government telling me what I may or may not do to run my company. That's why I tried to draw the distinction between what I view as being a mandate on a business by government and what I view as respecting the individual, the choice and the autonomy of people, and what kind of medical decisions they choose to place on themselves. As an employer, that is none of my business.
Do you think the word mandate's appropriate when, in the sense of no one's being forced to take a vaccine, but some people are being put in a position where they have to make a tough decision, get the vaccine or lose their job? It's, again, not a mandate, but do you think the word mandate's maybe overused here?
I view that as a mandate because if they are not going to comply with getting the vaccination, they will be fired.
I know some of your supporters have said, you know, it's my body, it's my choice. Do you agree with that?
Absolutely.
And does that extend to other medical discussions
Absolutely.
like abortion?
As an employer, absolutely. Now, I am also an individual and I have my own views on things like abortion and other things. So, but as an employer, it is not my job to interfere with those personal decisions of my employees.
Do you think this is a situation of a vocal minority being here today and speaking out, or from what you've seen, is it more than just a vocal minority as it's been described?
I believe it's more than just a vocal minority. This is growing across the state. It's growing across the nation. And so I would just advise my colleagues in the legislature and other elected officials to heed the call.
Do you have concerns about the vaccine rates in Idaho? Would you like to see them be higher?
Well, I'm, again, leaving those decisions up to the individual. We've done everything we can to to help educate people, and I encourage people, if you want a vaccination, then get one. And I know that the vaccine has been a good thing for a lot of people. It's given people confidence to be able to go back out into the community, and I encourage that. But there also has to be a reason why still a majority of our population has not had it. It might be like myself, that I believe I already have the natural immunity, which is stronger than the vaccination. So there's probably a lot of that that's out there as well. And we need to respect that.
A lot of the commentary around some of your comments is that you would support, government overreach or government telling private business what to do. Can you explain the difference between what you're doing here today in terms of, advocating and what, government overreach would actually be?
But, well, I think we just have a difference of opinion of what I don't view respecting the individual right of a person to make their own health care decision. I don't view that as being in conflict with or a government entity respecting that. I don't view that as being a mandate.
All right, a couple of takeaways from just what we just heard, Joe. First thing, the natural immunity that she referred to, I guess maybe alluding that she did have COVID-19 at some point, or maybe was exposed to it at some point. I don't know what that clearly means, but there's really not a lot of evidence that says that those who get it would have more immunity than those that get the vaccine. That's still debatable. The other one, the vocal minority question that you asked her, she said at the beginning of that press conference, they had 405 emails and phone calls into her office about this. 405, that's not a whole lot. It's not a huge number. I don't think that is anyway, considering they had like more than 1,000 when it comes to who they appointed to the CDH board for Ada County. Now, the question is, when it comes to the FDA, okay, so say this thing is approved and gets that final approval, which could come by the end of this year. Does that change the tune at all?
Yeah, I asked the Lieutenant Governor about that specifically, asking her, if the vaccines, when they get their full FDA approval, if her stance would change. And she said, simply put, no, but it's not because of the COVID vaccine specifically. She's against this in principle. She says that she doesn't believe that Idahoans or people should be going against their own will to go get any medical procedure or any medical treatment done. So to her, this wasn't necessarily specifically about COVID-19, but this was more about the sense that she doesn't want employers having to tell their employees, you need to get a vaccine or lose your job. She thinks that Idahoans have the right to their own personal medical choice. But it is interesting, Brian, because if you talk to other people that were there today, I heard comments, people saying, well, I would reconsider my stance once the FDA approval is finalized. Some people are just waiting for that to go through the process, but it's two very different camps, where you have one camp that says, I don't want to be told what to do ever. And you have one camp that says, I will take the vaccine, but I want to wait till it goes through the entire traditional full process. Again, it is important to note that the FDA process with the vaccines, it did go quickly, but it's not like they were skipping steps. It's not like they were just pushing out a vaccine to get it out in time. Right. It was done quickly. We've spoken with Idaho medical experts for months about how that process went. And it is important to know that the vaccine has been tested and it is safe. And we are seeing very, very, very few accounts of adverse reactions.
And so the next question too would be some of the data that was kind of thrown out there today. There was this reference to thousands of employees would be affected by this if these go through. But these are only 3 healthcare providers, and as you mentioned, we've already required the flu. They have already required the flu vaccine to work there in that capacity, other than an exemption. But this hasn't come up before, and now all of a sudden it's an issue because of COVID. But the data, she said thousands of people. We talked about this, right? St. Luke's, 15,000 employees or so. They say 80% of their employees have been vaccinated. That's only about 300 or so that haven't. So if you add all those together, it doesn't seem like thousands of people affected by this.
I guess you could say in the sense that it affects thousands of people in terms of saying that there are thousands of employees that could be faced with making this decision. And then of that pool, how many people would say, no, I would rather not take the vaccine and go work somewhere else. So if you look at it through that lens, I think you could say that it would affect thousands of people. But Brian, from what I understand, healthcare workers that we speak with, we're not sure this would affect thousands of people in terms of thousands of people will be losing their jobs in September.
Okay. All right, Joe. Well, a couple other things from this morning to get together. Lieutenant Governor McGeachin made it clear she didn't have all the answers on how this should be resolved, other than just asking the hospitals to withdraw their get vaxxed or get axed policy. Lieutenant Governor did concede maybe there could be considerations when it comes to COVID vaccine reluctance. According to the healthcare companies that announced these requirements a week ago, there are already a couple of outs with the medical and religious exemptions. McGeachin said those aren't enough.
Those are options, but medical and religious exemptions are not easy to come by. And so maybe that's something we need to look at. Are those so restrictive that it may not apply to everybody? If it's not religious or not medical, just simple conscience that they just don't want to do it, that should be respected somehow.
Well, those companies could argue they do respect those that just don't want to do it, and they would kindly respect them from a distance while they look for alternative employment. As for those medical and religious exemptions, Lieutenant Governor is correct. They're not easy to come by. When we spoke with St. Luke's about this last week, they told us a board of clinicians will decide who gets those exemptions, the medical ones anyway, just like they already do with the flu vaccine. And it is a rigorous process. And those that get them, especially the religious exemption, we're told is a very low number, like less than 5%. But I would guess that's the point, because if exemptions were easy to get, what would be the purpose of the requirement? Wouldn't really be much of one, now would it? So let's say the Lieutenant Governor and all of those in attendance today get their way, and the state of Idaho decides to tell private businesses they cannot discriminate against an employee because of a personal medical decision. Where does that stop? For example, if a chiropractor in Meridian decides he doesn't want to serve patients that have had the vaccine, stay with me here, would it be okay if he wanted to require the same of his employees, demand that they not get the vaccine or not come into work?
Well, I think that's a dumb thing. It's a dumb decision by the chiropractor. I mean, seriously, if you are an employer in the state of Idaho right now, you know how difficult it is to find employees right now. And I would never do, as an employer, I would never do anything silly like that, because I want my employees and my business to take care of the needs of our customers.
But he would have a right to do that.
He may, but that's silly for a business owner to run people off like that.
Maybe silly, but it's true, and it could happen. That chiropractor I mentioned, his name is Dr. Stephen Baker. He has a practice in Meridian with 4 employees, and he also has quite the interesting perspective on the pandemic and the COVID vaccine that we won't get into here, because he also has a podcast in which he said in an episode back in May, he was concerned the vaccine, not those that got the vaccine, but those who were just around those that got the vaccine. He was concerned it was having a negative effect on menstrual cycles. It's not.
So I instituted an office policy where if you are a member of my practice, if you're a patient and you make what I would consider a horribly poor decision to go get this shot, then you need to go home and not come back to the office for 30 days.
Dr. Baker told me today he's not kicking anyone out for good, but he didn't have a reason for that arbitrary 30-day number. He's still gathering information, and yes, he's lost some patients because of that policy. I also asked Dr. Baker if that policy would apply to employees, and he said this: none of my employees would ever get the shot because they are too intelligent to do so, and if they did, the same policy would apply. I would ask them to stay away for 30 days in an effort to protect people in my office. Would that be a paid furlough? Well, he said that would be a situation-by-situation basis. Doesn't really matter, because with all the nuance to this, all of the things we may not consider because, well, that would be silly, the bigger serious question is, how far are we willing to go with this? Are we willing to let a pandemic force us to rip open a Pandora's box of government intervening in private business? It's okay for an employer to discriminate against an employee who made a medical decision to get vaccinated, but it's not okay for an employer to discriminate against an employee who made a medical decision to not get vaccinated. Wildfire season is off to a fast and smoky start. And that smoke, which seems to be coming from everywhere but Idaho, is funneling into the Treasure Valley. And the air quality is spiraling too. So the smoke is supposed to stick around for a while, just like you're supposed to stick around till the end of the show. That's where we share the text you've sent in. Wait, you haven't done that yet? Well, there's still time. Grab your phones and text us your questions and your comments. 208-321-5614. Be sure to include your name and the hashtag #the208.
early, along with the smoke as well, and that it could stick around just for a little bit, at least more than we're comfortable with. So it might be a good idea not to throw these masks out and instead mask up from not only COVID, but now from around us.
You saw the haze on that 7-day forecast. Yeah, it can be harsh on the eyes, more harsh on the lungs though. And unfortunately, it sounds like that smoke is going to stay around for a while. The air quality also not going to be so great. Not great right now across most parts of the state where it's at moderate or unhealthy levels for sensitive groups. But who is in that sensitive group, and just how the smoke particles entering our bodies impact our overall health? Here's Katya Stepovic.
It's gray, eerie, and ominous.
We just typically don't see this amount of fire with this amount of smoke this early.
Sadly, it's overstaying its welcome.
We're looking at a couple months at least with wildfire smoke in the area. Long term, I think we're going to see the smoke through the summer and into the fall.
Mike Toole, the regional airshed coordinator for the Idaho Department of Environmental Quality, says the smoke accumulation welcomed itself to the valley earlier in this season than usual, most likely because of, you guessed it, weather conditions.
Our area is very weather dependent for air pollution and air quality, and with being surrounded on every direction with wildfires, at some point, depending on when the wind's coming from, we will have smoke probably coming in.
Right now, most of the Gem State is in a moderate air quality level, with some good levels in northern and southeastern Idaho. And unfortunately, the unhealthy forest-sensitive group levels are starting to pop up too.
Probably mid to upper moderate is going to be the consistent number that we see, with some days higher and some days hopefully a little bit lower, but no real big relief coming that we've seen.
Not only is bad air quality an eyesore for many, but for some, it can cause physical pain.
When you see pollution outside like this, there's a lot of chemicals in that air. There's probably multiple chemicals in that air that are irritating our lungs.
Derek Hamblin, medical director of urgent care at Primary Health Medical Group, says we're all likely sensitive to poor air quality to some degree. But those more sensitive usually have underlying lung diseases like asthma or emphysema, and being young also increases your sensitivity.
I think they're just more sensitive to the environment in general. I think, a lot of times we get to be older, with reactive airway disease, we may have less of a sensitivity to the environment, and our lungs, as they kind of grow and mature, can become a little less sensitive.
Irritation from the lungs can cause inflammation, and if you're sick with any kind of virus on top of that,
you're talking about compounding or extra variables coming into play together, right? So if somebody obviously has COVID, or even if they just have a cold, another virus, and then you have poor air quality, then that can certainly make their situation worse.
Just like our skies, the end date to the poor air quality isn't clear either. So in the meantime, try to reduce your risk.
When we get to that red category, which is unhealthy for everybody, that's when we strongly recommend that everybody limit their time outside. We haven't hit that mark yet. There is definitely potential for that, especially if we continue down the path that we're going.
Now, Mike says we may get a little bit of a break from the smoke that you see behind me, at least heading into this weekend. But he also says that this wildfire season and the smoke that has come with it has come very early, and like we heard, could stick around for a while. So, Brian, it may just be time to actually hold on to from the smoke that you're seeing all around us.
That's true. I know it may not look like that or may not be in that red category, but some of those shots you show, it does look pretty nasty out there. And you wonder why we aren't in a worse health category when it comes to our air quality. All right, thank you very much, Katya. I know we spent a lot of part of this show at the Lieutenant Governor's press conference this morning talking about what she said and what was said there. Maybe we'll go back and do a little bit more because it's not about what she said the whole time, what Joe Paris said more than once. In an effort of transparency, we're going to show you, just to have a little fun with Joe Paris and what he asked of Lieutenant Governor at the end of that interview.
Finally, on social media, I've noticed that you've, and final question for you, sorry, I totally forgot. Do you think this is a situation, sorry, and last one, I promise the last one.
Last question.
As a governor, as a government leader, as a leader of this state. So are you, I guess.
You said
that was my last
question.
one. No, you're right, Lieutenant Governor.
Brian
but I have already, I've all
waiting
kinds.
patiently here.
He is.
All right, you know Joe was on vacation for a while, so he's kind of getting back into the swing of things. But yeah, I was waiting patiently to ask Lieutenant Governor some questions as well, which we did. Just having some fun with Joe. All right, before we get to your comments, one thing I wanted to clarify. Correct, actually. 12,000, 15,000, that's a difference of 3,000. I understand that, not 300. I misspoke. So yeah, thousands of employees at St. Luke's could potentially be affected by this decision. I'm so confused. Is it a longstanding tenet of the Republican Party of firm opposition to government overreach, particularly in regards to businesses? That question has been tossed around a lot. We spoke with Speaker of the House, Scott Bedke. We've spoken with the President of the Senate. That would be Senator Chuck Winder. They all say the same things. They're reluctant to jump in and start telling private businesses what to do when it comes to what they can require of their employees. There are two basic types of people in Idaho: people who care about the health of others and those who only care about themselves, says Steve. True, but sadly not new. No question which group our lieutenant governor favors, says Steve. Private industry can mandate anything they want. They mandate no smoking because it is a public safety issue, just like not getting the COVID vaccine is a public safety issue. Seatbelts, smoking, lots of things are mandated by the government that are there to protect others. Absolutely love the in-depth interviews on the 208. Thanks, Bill. We do too. We hope to provide more of those to you. A little more time to get a little bit more of the story. We'll see you back here tomorrow.